Hello, everyone. This is Ryan Carlson with HealthJump, and we're back with Cliff Kavanaugh, the Chief Technology Officer of HealthJump. And the question for today is, Cliff, do you feel that interoperability of 5 years ago means the same thing as it does today?
Like the word interoperability?
Interoperability, both as it means from an industry standpoint, but also what we expect from it. Like the use cases, the applications.
That's a somewhat of a complex question, but one I think there's an understandable answer to, and that is that yes, it's the same, and yes, it's unfortunate, but the only reason that it's the same, despite the progress that we've made in healthcare, the reason it's the same is because I don't know that it was ever really defined in a way that every stakeholder in the healthcare continuum, when they heard the word, they understood it the same way. I don't think that ever happened. Interoperability in healthcare, at least my time in healthcare, has always been married to this idea of a promise, this expectation of, well, with interoperability, we'll be able to do something, whatever that thing may be. And early on, that was, and even before 5 years ago, that was very much associated to having the patient more involved with their care. Oh, once there's an interoperable system, then scheduling appointments will be much easier. But not only will schedule the appointments be much easier, but getting the outcomes after the appointment will be much easier. The interaction between patient and clinician in between visits will be a tangible thing and will reduce the cost of healthcare because patient needs to be seen less, it's taking up less of the doctor's time. And so the promise of workflow changes were very much tied to interoperability. And then a couple of years later, the promise of a change in reimbursement from fee-for-service to pay-for-performance that we've talked about in the past. Well, once we can be in an interoperable industry, then that will be possible because reporting at the population level will be possible and so on. So interoperability in the context of the way the industry looked at it for even longer than 5 years ago has not been a very, I'll say, defined thing in everybody's mind, but it's always been the precursor for affecting big change in the industry. Now, for those that were very close to, let's say, their EMR deployment at their hospital system or their practice, the word interoperability started becoming associated with a meaningful use requirement. So if they wanted to get paid for using the EHR that they just spent a lot of money on, they had to check a bunch of boxes about how much of that EHR they were using. And in 2011, the mandate for interoperability under that rule was just that you communicated with your patient, that you did that. And that was like the first of a number of phases that were to come that we're doing what I'm saying didn't happen, and that is defining interoperability. And then the second phase of that, again, was to check another box in the stage 2 of meaningful use so that you could get paid. And again, it's more than just interacting with the patient. And then things changed a little bit with phase 3. That was like in 2015, things changed a little bit. And I don't have to go into it, but I'm using this as a reason for the confusion in what interoperability is, in the sense of, okay, from today's perspective and the previous perspective, there was this confusion of, okay, it was a promise of things to come and change to happen in the practice. And then, okay, it's just this thing that I need to do to meet meaningful use and check a box, but things aren't really changing for my practice. And then, so for us as consumers of healthcare, for patients and so on, we've seen some things happen, right? We've seen the ability to message our doctors securely, and we've seen the ability to schedule our appointments a little easier, and we have seen the ability to provide feedback or request a medication, let's say, without having to pick up the phone. We did see some workflow changes, but to us, that's not interoperability anymore. That's something completely different. And I think that ambiguity in the definition is why I say that it hasn't changed.
When I hear interoperability and just how you described it, it's almost like Smurfy. You know, the cartoon from the 80s, Smurf this, Smurf that. We're all getting Smurfy. Exactly. Interoperability, I'm hearing I'm hearing it as an action, as a mandate, as a desired outcome or even as like a campaign promise?
It's also an excuse. Oh, we can't do this because we're not interoperable with that system over there. Or we can't do this because, and I'll tell you, I was just I'm part of a committee at the FDA referred to as RAPID because it's trying to help accelerate not just the approval of drugs at the FDA level, but also looking at real world evidence of how post-market drugs are either being used or their efficacy. And one of the things that came up, and this is a very relevant point, in that when we were discussing registry data, and for those that aren't familiar, there are a number of registries, healthcare registries that, and believe it or not, in large academic centers, they actually hire like full-time employees to submit data that's already in their EHR, but go to another system and submit data about a patient that might have a chronic condition that there is a registry for. And a very clear example of this is the COVID registries that now we all understand as having gone through this, whether you're in healthcare or not, that there is a registry of information for everybody that's either been tested for COVID or has had COVID. But the thing that's preventing registries from reaching their full potential in coming up with the best protocols or understanding the spread of a disease or whatever the case may be, is that the data that they have to which they have access is limited to the data that's submitted at the time that the patient is seen. But after the patient is seen, the patient might come back and see that doctor again 10 times, maybe for that condition, maybe for something else. But all of that follow-up is largely absent from the registry. And so all that useful data isn't part of the data set at the registry because there's nobody hand keying it in and sending it to them. The problem of this idea of interoperability is, okay, when we ask of the registries for more, they say, oh, we can't do that because we're not interoperable with that system. We can't pull that data out to know what the current state today is of a patient. And while that's true for registries, it's been the same thing for a lot of different use cases in healthcare. And when we talk about the narrative of reducing the cost of healthcare, very similarly, well, we could if we were more interoperable.
Interesting. So if this is not the right word, interoperability it's an excuse, a campaign promise, a desired outcome, a mandate, or an action, then what do we use?
I think that's just it. I think the idea of interoperability and the reason that word made sense in a lot of ways that are really interchangeable is that's in our mind's eye how we picture systems between each other. We think about needing to interoperate one system to another system, a single system. And for a long time, and we think about just being computer users in an office, let's say, that's how it worked. The computer that you were using needed to be connected to some server that had data that you cared about in your environment. And so your Microsoft Word application needed to be interoperable, if you will, for lack of a better term, with those files so that you can get data from some other source. It's point to point. But that's not how software is developed anymore. I can't even think about the last time I installed a client server application where there was one single server that I had to install one component and then a piece of software that I had to install on a workstation, right? We don't work like that anymore. And the reason for that is because data as a whole, we've realized, can be completely separate but centralized and secure but accessible without interoperability. It's just accessible natively. When we think about something like a web browser doesn't have to be interoperable with the web browser, just conforms to certain standards. And since it conforms to certain standards, it can work with all of these other systems without there being a point-to-point interoperability step. And that is how I think we as an industry and consumers are looking at healthcare and saying, we're not there yet. Why? And if we change the picture in our mind's eye a little bit about how to make that work, it's not interoperability. And I'm going to sound like a broken record here, but it really is data liquidity. It is the separation from data and application. application is just a way to access data, but data itself should be longitudinal, it should be accessible, and it should be complete. And a situation like the example of the registry, right? The registry itself shouldn't need to interoperate with a single system to get more information about an illness. There should be a way, and there is, but from a technical level, but it hasn't fallen into the government incentive programs, if you will. But there should be a way to access a registry that has the complete data, and then there be segments of that. All right. So if there is, again, COVID registry, then they're accessing a portion of that data that only applies to patients that have been treated for COVID or have been diagnosed with COVID, et cetera. In the same way, we do this in a lot of other industries. And I think the only way for us to change that picture in our mind's eye is to just change the word. We need to stop saying that lack of interoperability is the excuse for not being able to move forward. We need to change the expectation that healthcare data needs to be liquid. It needs to be in a format that is accessible from other systems without that system needing to know anything else about the network in which it sits on. I can pull from the Facebook API today without knowing anything about Facebook servers, without knowing anything about Facebook's network. Why? Because there's a standardized way to get that data that's intuitive for developers, and it doesn't require the same level of network access that we needed to put in place in the past.
I like that. I've never thought about it in that way, especially where you're talking about how even software systems themselves have changed.
Mm-hmm.
Where it used to be a series of client server relationships, it used to be a series of different systems that had to work with one another. But now that I think about banking, you go to any large financial institution, it's the same repository of data. It's just, I have an online banking view that only lets me see my current balance. But then the teller has a different view, just like a registry should just be a specific view, a specific contextual view into that data set that is available.
That's right.
That seems to be that we're looking at different dimensions of interoperability. And it's not only over a period of time does the context change, but interoperability is no longer it's not the goal. It's not the action. It's just the expectation. And we need to use different words to define the problem, the solution, and the end state.
Very accurate. I think that's a good synopsis. I think another example of this that we all as individuals probably understand is that this is with travel. And if you think about the airline system, while you might not need to have access to how much I paid for a ticket or information about me as the passenger or whatever, but if I want to schedule a flight, I can look across all of the, and I'm saying I as a user, but the systems on the back end, they can look at the availability of flights for however far out you can imagine, but across every airline. Why is that? It's because those data are not only standardized, but they're centralized. And so the things that do need to be walled off, like me as a passenger, like me as a traveler and my individual transactions, that needs to be walled off. But the data that's valuable for the industry of travel is the data that's
right.
What enables an ecosystem to exist and competition to grow and so on and so forth. It's because they've achieved data liquidity in the travel space and without giving up security or privacy, et cetera. It's the same thing in healthcare. And it's something that we as the consumers of healthcare should begin to just expect and not let this lack of interoperability be the excuse for lack of innovation.
I think this is a great summation of this topic, and thanks for discussing this. I think we've got some additional things to unpack in future conversations, so I look forward to sharing those with everyone out there. So Cliff, thanks for your time.
Oh, my pleasure. Thank you, Ryan.